Hey, it's Dr. Goodman, the orthodontist. I hope your summer is going well. When I email a patient video or post it, I always don't use the patient's real name. So I am renaming our patient Jay. Hello, Jay. So let me show everybody what we have accomplished so far and what's left to do. So we started this treatment about 6 months ago. And actually, it was 24-week treatment to date. When we started, Jay had this one tooth that was severely out of position, and there was not enough room for it. This tooth was also crowded, but not to the same extent as this. Now, my original diagnosis showed that the width of the palate was not extremely narrow, not even that narrow. And I'm telling you, having been an orthodontist for 30 years, this would be treated with a metal fixed palatal expander for in many offices. And so we've moved away from that in cases where the palate is not specifically so narrow. And instead, what we did is we used Invisalign. And if you can notice, there's more width. So we did widen, but we didn't widen the bone. The palatal expander that's fixed with a metal device that the parent has to turn will widen the bone, but that is not needed in cases where the crowding is moderate. Or even if the crowding is severe, if the jaw is not skeletally constricted. So we've got more width here. I even have a table that will show us an analysis where you can see in the upper arch, this is in the molar area. We started 45 and now we're 47. 2 millimeters is a lot. And then we've widened it at the primary teeth almost a full 2 millimeters as well. And same at the canines, 32.9 to 34.6. So this is great dental expansion when you don't need a ton. And we've also aligned the teeth at the same time without braces using Invisalign. This has all been done with Invisalign. If I haven't said that already, you know that, but just for others who might be watching this. And the aligners expanded the dental arch and aligned the teeth up at the same time. Now, this tooth is still not where we want it to be, but it will be with another 17 aligners. And at the end of the 17 aligners, it may not exactly look this ideal, but it will probably look something like this. At that point, we might even get a little bit more, or we might accept the progress. The goal when you're treating a patient who's age 7, 8, or 9 is to not necessarily have perfect alignment, but a vastly improved alignment. Now, the lower arch had some crowding as well. You can see how these teeth were rotated, and here's where we are now. So good progress as well in only 24 weeks. No braces. As you know, Jay's been able to eat whatever Jay wants to. It's much easier to keep the teeth clean. The palatal expander can be difficult, the fixed one, so we don't have that. And these are invisible, so they look nice. And I also will point out that we didn't use a single attachment in the case. Let me correct that. We did use them on the molars, but nowhere else. So I really try to limit them. I am going to now add in refinement an attachment on this tooth. So this is just a good case review. Great job, Jay. And we'll see you. We'll have these back for you the time that you requested in about 2 weeks, or maybe slightly less. Take care.